The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Good afternoon, everyone. My name is Dr. Charlene Ortiz, and today we are going to begin a new lecture. Our lecture involves experimental designs. Now, previously in other chapters, we have covered what an experimental design actually is, but we cover them in very general terms. So in this lecture, we're going to be very specific in regards to studying one specific aspect, one specific type of experimental design. And that experimental design is what we know as between subjects experimental design. So let's get started. Now, one of the things that we must do is first define what between subject design means. What between subject design means. What we're trying to do is we're trying to manipulate the levels of a between subjects factor. Right? So we're trying to, whenever we have that specific level, we have different participants, right? So for example, we don't have a group that we're showing, say, group A is going to be the same group that is going to be manipulated. So notice that what we're trying to do is that different individuals are going to be observed one time in each group or at each level. Now, notice that in regards to the between subjects experimental design, notice that once we start utilizing the term experimental, we're starting to move into different sets of requirements. The first requirement, if you recall from an experimental design, is that it indeed needs to be manipulated. It needs to be manipulated. Also, we should have as a significant requirement that random assignment for each of those levels, right? So remember, between subject designs is interested in different levels, right, of a specific factor, of a specific variable. So notice that I, number one, need to be able to manipulate that variable, and I should be able to randomly assign these groups or each level in a random fashion. Now, when we refer to a between subjects factor, because you did hear me mention the term factor before, what we are referring to a factor is when we are observing these different types of participants in each group or each factor. So, for example, think about when we have a specific level, right? So I have a level of therapy, right? So the independent variable will be therapy, and I say general outpatient, intensive outpatient, and residential, right? So notice that those are different levels of the factor therapy, right? So we have the larger variable, right, which will be therapy, and then within that level, within that factor, I have different types of level, right? So we would have general outpatient, intensive outpatient, and then residential or inpatient, right? Any questions so far about factors or levels? Good deal. Fantastic. So let's revert back to our slide. Notice that one of the processes that we have to do, and this is a really nice illustration of how that would look like. These are the steps that we would utilize in order to develop a between subjects design. The first thing that we would engage in would be to actually obtain that sample, right? A portion of that population that hopefully it is representative, and we can conduct our study. The second step that we will look into in between subjects design, notice that here you're interested in creating 3 or more groups, 2 or more groups, I should say. So notice we can have a group that is indeed manipulated or is indeed exposed to the therapy. And then we have another group that is not exposed to therapy, right? Also, we would consider that the groups that are exposed to each level are also separate groups. So we can have a group that is exposed, say, to general outpatient. Then we have another group that is exposed to intensive inpatient. And then we have a third group, and that one is going to be residential or inpatient. So notice that now you're having different groups or levels of that independent variable as noted in your second step. After you had created these groups, what you are concerned with is you're going to assign these individuals randomly to these different levels that you are manipulating. So you're going to assign them randomly. Now, the intent of assigning these individuals to different levels of that factor is because we want to measure that same variable in that group. So for example, if I assign, say, 50 people to the general outpatient and 50 people to the intensive outpatient, and then 50 people to my intensive, or I should say inpatient, notice that the intent, say for example, is to measure the same dependent variables. So for example, there are symptoms of substance use, right? So notice that all groups, what I am intending to do is to measure the same variable, the same dependent variable. One of the last things that we're going to do, we revert back to our slides, notice that we're going to use inferential statistics. We're going to use inferential statistics to realize and notice if there is in fact a difference, between those groups. Essentially, we are going to compare. We're going to compare these groups and see, I wonder if these symptoms and the response to treatment between outpatient, intensive outpatient, and residential are different, right? Is there a better treatment modality, right? Or treatment setting, I should say. So that is your main goal. Now notice that the reason we engage in these aspects is because essentially we are trying to make a decision. And that will be your last step. Because notice that when we're doing a between subject study, you as a practitioner, for instance, or a researcher, you can make a decision and say, perhaps for this type of individual, an intensive residential inpatient treatment modality might be better than, say, just general outpatient. So now you're making a decision based on those inferential statistics and your analysis of such inferential statistics. So any questions about that? Fantastic. I'm lacking on my fantastic. Lacking. So remember that we were talking about assigning individuals to an experimental and control group. We have mentioned this before, but let's do a very quick review on the matter. Notice that we are going to have first that control group. And what is a control group? Right? What we're trying to control, whenever we use the term control, is that we're trying to hold all other variables constant. We want that exposure, right, to be the reason why we can draw conclusions, right? So for instance, Say the only variable that we want to observe is that treatment modality, right? And you want to have a control group that has not been exposed to anything else. And the same goes for that experimental. And why is that? Imagine that you're trying to measure the outpatient, right? The outpatient variable intensive and residential. But then the group starts, say, for example, attending a religious service that assists them with the reduction of substance use. Notice that that variable now is going to perhaps contaminate your assessment and your inferences, because did they report better symptoms because of your treatment modality? Or are they reporting better symptoms because they started attending that service? So notice that because of that contamination, if you will, now we can sincerely justify that my intervention, that manipulation was indeed what caused those differences in the dependent variable. Any questions about that? Good deal. If we revert back to our quick summary, notice that in the experimental sense, which we also refer to the treatment group, notice that these individuals are indeed treated, are indeed exposed to whichever manipulation I am engaging in. So in the case of our hypothetical example for research would be the treatment modality, or the treatment setting, I should say. It could be medication. It could be whatever aspect I am able to manipulate. Why do we hold everything constant? Because we want to ensure, we want to be able to ascertain whether or not those changes were caused by the dependent variable. So any questions about that? Good deal. Fantastic. So let's revert back to our slides. Now, whenever we are exposed to experimental manipulation, what we're trying to do is identify that independent variable, and I'm going to create at least two or more groups. Those groups are also referred to as the levels, right? And again, remember, if I have general outpatient, intensive outpatient, notice in that manipulation, I am ergo creating my levels. Now, we do have different methods to do this, and we have covered this in the past, but as a quick refresher, notice that we can have a natural manipulation. And what we mean by that is whenever we are trying to engage in that manipulation of that stimulus, this can occur naturally, right? It can occur naturally with very little effort. In this particular case, we like to think about a physical stimulus. And for example, in keeping with our theoretical or hypothetical example, think about if I were to offer this treatment, right, outpatient, for example, and I'm only studying outpatient, but then with one group, the room temperature is super low, and for the other group, the temperature is going to be super high. So notice that with a physical change, right, I was able, with very little effort, to conduct a natural manipulation. Now, we can also engage in a stage manipulation. And if we revert to our presentation on your screen, notice that what I am doing is that this manipulation is going to require that that participant is set up, right? Is set up to that stimulus, right? To that event. Notice that here is when we start looking into a confederate, right? A co-researcher, right? That is basically aligned with the researcher in order to set up this experience, right? Let's talk about, for example, something that I have utilized before in other lectures, and that is flirting, right? Studying flirting behaviors in a college bar setting. So think about if you are my research assistant, right? And part of your job would be to flirt, with individuals in the club. Notice that I am setting up that participant, right? Because I have a confederate or because I have a co-researcher that is trying to set up and put into motion the experimental process, right? They're trying to be part of that manipulation, right? So it didn't necessarily occur naturally because now I utilize a confederate or now I utilized a co-researcher. So that is a quick review of aspects of natural and stage manipulation. Any questions about that? Good deal. Fantastic. Fantastic. Let's discuss aspects of random assignment. Random assignment. When we are looking into random assignment, this is the process that we refer to ensuring that every participant, that each and every participant has the same likelihood to be selected or be given a group. Right? To be selected or be given a group. The intent of this process, first of all, is to reduce bias. I don't want to put the very severe people, right, that are dealing with substance issues in my residential, right? I want to be able for those to be spread out and have equal opportunity to be assigned to whichever group randomly, because otherwise my results are going to be skewed. One of the advantages that we can see with random assignments is that it accounts for those individual differences. It accounts for individual differences that we may see with a participant. We're trying to make them about the same. We don't want our results to be skewed because we put, say, for example, all the males in the outpatient, right? Or we put all the females in the intensive outpatient, right? That is an individual difference that is going to impact my results. When you hear me use the term individual differences, the term individual differences refers to a unique characteristic that you as the participant carry. You carry that characteristic. It makes you different from other participants. Some of them, for example, can be your level of intelligence, your marital status, you're single, you're married, you're male, you're female. You're intellectually bright, intellectually gifted, not intellectually gifted. So those are characteristics that impact the research. And why is that? Well, if I start randomly assigning, I reduce the chances that those individual differences did affect my research and not necessarily my manipulation of that independent variable. I can attribute those differences to the independent variable instead of perhaps issues with differences in my participants. Let's talk a little bit about restricted measures of control. Restricted measures of control. If we revert back to our slides, when we're thinking about restrictive measures of control, notice that sometimes I simply don't want to leave it to chance, right? I don't want to leave to chance those individual characteristics, right? Sometimes I do have a specific purpose in purposely assigning, right? Purposely assigning or doing certain things that impact that control. That's when we look into restricted measures of control. Generally, what happens is that researchers can take steps to control the assignments by using restricted random assignment. Now, what do we mean by restricted random assignment? We are restricting that specific sample because of a known individual difference, because of a known characteristic. Notice that I could engage in control by matching. And when I'm looking into control by matching, what I am trying to do is that we want to measure We want to assess a characteristic that we can and we want to control. Say, for instance, I have identified, say, for example, based on a particular score, right? For example, this group of individuals scored really high on that substance abuse scale. Maybe I want to assign these individuals to that residential inpatient treatment. Maybe I do want to do that particular assignment. Now, another aspect that we can engage in is control by holding constant. Control by holding constant. Now, notice that in this specific case, we're trying to exclude participants who may exhibit characteristics that may otherwise be different between these groups. Right? They may be different between these groups. Notice that in this particular case, I don't necessarily want to include these participants, right? I'm trying to control and hold these matters constant, right? Because of those characteristics that they may carry, right? So for example, a type of personality, right? A type of personality could account for substance use. Say, for instance, individuals who are more risk takers, right? So for me, it would be important to hold that constant because if I know that this could impact my study, this is a characteristic that they may have not deferred to in the first place. So any questions about that? Good deal. Good deal. So if we revert back to our presentation, notice that there are ways that we can measure that variability, right? There are ways we can measure those changes within that independent variable. We can also measure individual differences in numerical terms and a numerical fashion. And how do we do this? We do this with measures of error, right? Measures of error. One of the measures that we're going to discuss, if we revert back to your slides, notice that one of the things that we can measure is error of variance, and sometimes just simply referred to as error. What I'm trying to do in the Queen's English is with the error of variance, I'm trying to ascertain how much of that variance, how much of those differences between those groups can indeed be attributed to individual differences. How much of these differences did indeed come from individual differences? Because despite of you trying to control, despite on you trying to randomly assign individuals or restrict individuals, despite of your control of the setting and the manipulation of your variable, there's always going to be an amount of variability, of error that did not come, that variability did not come from your manipulation of that independent variable. That variability simply came from error, but we do have the ability to measure that error. Now, generally, when we are looking into this type of error, the more the scores are overlapping, the more likely, the larger that error of variance will be. If, however, those scores tend to overlap less and less, notice that now we can say, well, there's less error of variance. And because there is less error of variance, I can start ascertaining, well, because there is less error, that means that variance came from my independent variable. It came from my manipulation. It didn't come from the differences in my participants. What are some of the processes that we can engage in? Notice that we can do test statistics. Irrespective of whether an effect in a sample was observed or an effect was observed in a sample, notice that it is likely that we're going to observe that difference in the population from which that sample was selected. Notice that we're trying to note with that test statistic the extent into which these specific differences that we observe between these groups can indeed be noted because of that manipulation that I used in the first place to create the different groups. So in keeping with our example, in other words, notice that what I am trying to do is say, if I do a test statistic, I want to be able to say my manipulation of it being general outpatient, intensive inpatient, and residential, I want to be able to say, is there in fact that manipulation? That's what caused the differences in symptoms and substance use? Or was it because those individual differences? We're actually going to see an example of that overlap. Actually going to see an example of what that would look like. Any questions so far? Good deal. So let's revert to this illustration, right? And what is this illustration? This illustration is trying to demonstrate, right? It's trying to show us those aspects of why is it important? Why is it important to measure error of variance? We're going to have the opportunity to see those error of variance in an experiment. So the first thing that I want you to look at when there is no overlap, And remember, when I see no overlap, in the differences in groups, for example, if we were back to our illustration, think about general outpatient or treatment A and intensive residential treatment. Notice that when we are looking into that treatment, the frequency of scores, say for example, for substance use, right? Notice that here, what we are trying to say is that therapy, not individual differences, because there is no overlap, therapy, not the individual differences, had the effect in the frequency of symptoms. However, if we do have an overlap, so if you notice here, the overlap that we have with our second treatment, for example, 1, and that overlap with 2, 3, and 5. Notice that the concern now is that 1 is going to be smaller than the rest of the items that we see here. And because of that, I'm starting to notice an overlap. What that tells me is that there is a greater chance that because there is a large and more overlap, scores that overlap, that tells me that there is an error of variance, that it wasn't my treatment modality that actually led to these results, but rather it wasn't the therapy, it was an aspect of individual differences, perhaps. So any questions about that? Any questions? Good deal. Good deal. If we revert back to that illustration, notice that their scores are overlapping with the scores of individuals who are receiving treatment A. But the idea is to know if, in fact, treatment A is different from treatment B. So, for example, treatment outpatient and treatment in residential setting. This is letting me know that because of this illustration, that individual differences are indeed causing those 3-point differences here. So for example, treatment A noted a difference of 2, whereas treatment B, notice a difference in 5 in those scores. So that 3-point difference, those effects in the groups, notice that because there is overlap in the scores, I cannot ascertain that it was indeed the treatment method. That was indeed the treatment method. Any questions about that? Fantastic. Outstanding. Good deal. Let's move forward to accountability, right? The accountability of manipulation. When we are looking into the ethical concerns of ethics, right? The ethical concerns of that experiment, notice that because you are indeed manipulating, because you are indeed creating and manipulating the levels of that independent variable, you bear a greater responsibility. You bear a responsibility in the treatment of these individuals. You're bearing a responsibility. So for example, think about the different treatment modalities that I showed in this illustration. Notice that some individuals are going to be receiving treatment A and treatment B, which inherently are different, right? Inherently are indeed different. So the ethical concern then stems, you are responsible for their treatment. You are becoming that person making a decision for their care, right? And the same would go for other forms of manipulation, say, for example, medication, right? Or treatment modality. So say cognitive behavior versus humanistic, or reality therapy versus cognitive behavior. So notice that because you are indeed that agent, you are indeed that agent manipulating that variable, notice that now you're bearing that responsibility. You're bearing that responsibility. Any questions about that? Good deal. Good deal. Now, one of the things that we would need to do is now we can also keep that comparison, right? We keep comparing the two groups. And in this case, they are independent samples, right? They're independent samples. Now, in order to conduct that between subjects group, we are going to ensure that these participants are selected, first and foremost, that are selected at random, and that they can be assigned at random. And remember, if we assign someone at random, that reduces the chances of having an error because of individual differences. Now, statistically speaking, we add another level of control by using test statistics. Because whenever we're using test statistics, what we're trying to do is determining the likelihood that something other than my manipulation caused those individual differences. Now, I need to remind you, we revert to our presentation. Notice that in a quasi-experimental approach, this method does not, in a sense, control for individual differences. I am not able to control for individual differences when it comes to a quasi-experimental approach. Why is that? Well, think about the example of, we're going to provide therapy, outpatient, intensive outpatient, and residential, and say our focus is going to be, say, individuals who are using heroin. Can you assign people to take heroin, right? I mean, I suppose you could, but would it be ethical, right? Would it be legal, right? So notice that we inherently cannot control within this method those individual differences. The participant came in with a substance use of heroin. I didn't assign that person, say, for example, to substance use regarding heroin. Any questions so far? Any questions? Provided that we cannot account for those individual differences in a quasi-experimental approach, because I cannot account for them, I am very limited. I am unable to demonstrate cause and effect, because I was not able to control for that individual difference. Now, with that said, let's look into selecting two independent samples. When I use the term independent samples, what I'm trying to say is that different participants are going to be independently observed one time in each group. And if we keep with this illustration at the bottom right of your screen, notice that we had the larger population and we drew our sample from that larger population. Later, I have the responsibility to assign them randomly into group 1 and group 2. But notice that these observations, right? These observations are being done with different participants. So there is a certain amount of individuals here, 50 individuals with different socials, different birth certificates, and then we have a separate group with different socials and different birth certificates. Notice that in this particular case, I am not utilizing these members here and then assigning them to the other group. So for example, these individuals are outpatient and outpatient only. They're not going to go to group number 2, which is, say, for example, residential. They are indeed different participants and they're only going to be observed one time. So say my residential treatment participants are not going to be, say, for example, at another time, be put in my general outpatient. Any questions about that? Any questions? Good deal. Let's look into the use of the test statistics. If we revert back to your presentation, notice that now that I have randomly assigned different participants to group 1, group 2, notice that my responsibility, once I have assigned those participants, is we're going to conduct the experiment. And make sure that we are measuring indeed the same dependent variable. So if we revert back to our slides, you'll notice that one of the things that we're trying to do is compare those differences. We are indeed trying to compare those differences between those groups. Notice that earlier we mentioned that that test statistic is going to be that mathematical formula to determine whether or not my manipulation is indeed causing those differences and not that error of variance, What we're trying to do is determine what was likely. Was it likely that those differences came from your intervention, or is it likely that it came from those individual differences? Now, how exactly can we come to this conclusion? Well, one of the things that we can do is a 2 independent sample t-test. So let's look at this term in 2 parts, right? Notice that here it's letting me know what type of sample am I dealing with. It's telling me that this sample is independent, right? It's telling me that it's independent, meaning that these samples are not filtered or not present in one group to the other. So notice group 1 is not present in group 2, and group 2 is not present in group 1. That's what we are referring to independent, right? It's also telling me the amount of groups that I am engaging in. So in this case, we have 2 groups. And this is the test that we are going to refer to as the t-test. Notice that in this specific case, we're trying to test the hypothesis. In order to test this hypothesis concerning those differences, we have to have interval or ratio data. You have to have interval or ratio data. We're trying to find the means. We're trying to find the means of each group. So now you're going to have those two means. Notice that you're going to have a mean for group number 1 and another mean from group number 2. Now, interestingly, another criteria for us to use this test, notice that not only do they need to be independent, the data needs to be interval or ratio, but also generally we utilize this test when you're simply unaware of what the variance is for the population. So generally, we have first and foremost independent groups. They are 2 groups, and we're comparing those means. Generally, it's because we do not have the variance of the population. So let me show you what that illustration looks like. Right, so if we revert to your slide, notice that in order to conduct that t-test, I'm looking for the differences between those groups. We're looking for the means. So mean of group 1 and mean of group 2. And I'm going to look for that difference between the groups. And what are the differences that we can attribute to error, right? So notice that these are the differences that we assume are coming from that manipulation. And these are the differences that we assume came from individual differences, or error in my sample, or the error in my sample. So at the top, we have those differences that we have observed in our groups and the differences that we can attribute to that error. Any questions about that? Any questions? Good deal. So let me give you an example of measuring, right? Of measuring this statistic. Notice, as I mentioned, that the numerator of that statistic is going to be the difference between the groups, right? So in this case, we have 2 groups, so group number 1 and group number 2. So this difference is what you're going to have in the numerator of your t-test. Now, notice that we can have at least 5 practical uses on average, right? So notice, let's say I have a difference of 3, right? And I believe that's the difference that we had earlier, right? So there was a 3-point difference in that treatment, right? So that is what we would find at the numerator. Notice that what I'm trying to do is, if I have a smaller error of variance, what is going to happen is that I have less overlaps in my scores. So it is more likely that it was the differences, that it was that manipulation that caused that factor. So the smaller this number is, the more likely I am to attribute that these differences occurred because of my manipulation. Right, so keep that in mind. This one's smaller, this one is going to be more likely. Therefore, I can ascertain that yes, it is in fact an attribution of my manipulation, of my intervention, and not because of individual differences. Conversely, if this number remains larger, the larger this number is, the less likely I am to ascertain that it was indeed my manipulation of that independent variable, that it was indeed that manipulation. Any questions about that? Notice that there could be some instances, I should say, that we are comparing more independent samples, right? So not necessarily just the 2, but there could be some instances that I'm trying to compare more independent samples. And again, remember, see independent, we're saying that one group of people does not filter to the other group of individuals, right? And we're only observing them in one occasion. Let's look at another method to compare this variability, to look into this variability, and that is a one-way between subjects analysis of variance. One way between subjects analysis of variance. What I am trying to do with this statistic, notice that the first criteria to use this type of statistic to measure for variability is that generally we're going to have two or more independent samples, right? And what we're trying to do is again test this hypothesis. But notice that in this case, it's a little different because here we're going to have one factor with two or more levels, right? With two or more levels. So notice that in this case, whenever I'm doing an ANOVA, I'm trying to go back and say I have this one factor. But this factor, I can start breaking down into different levels. And what ANOVA is going to do is it's going to observe for those differences, right? It's going to look for the observation with different participants, I should say, again, at each level. Notice that just like our t-test, the population, that variance of the population is also unknown. I do not know what the variance of my population is. Any questions about that? You may be thinking, why exactly do we need to conduct observations, right? Why exactly do we need to conduct more observations, more levels? Notice that if I only have two levels, I may not be able to ascertain if that variability came from my independent variable, because perhaps if I have more levels, that third factor, right? If I only had included two groups, I perhaps wouldn't have seen the full picture, right? So for example, if I only do outpatient and residential, I might have missed out on the data that can explain variability, say for example, in that middle level, which would be intensive outpatient. So you may not be getting the full picture. So that's one of the reasons why we do want to include different levels or different groups, because perhaps just having the two, it's not going to provide you with all the information that you needed, all the information that you could have observed initially. Now, another benefit of having other factors is that adding groups to a study can often help you in drawing better conclusions, right? Can often help you in drawing better conclusions. And if you recall from one of our very first slides, you'll recall that part of your intent was to make a decision. And if you're only including, say, two levels, and perhaps you would have had more information with three levels, notice that this is going to impact your ability to make a decision. It's going to impact your ability in making a decision. So that's another benefit of adding another level, Any questions so far? Good deal. Now, let's look into one of the things that we could do, which is conducting a postdoc analysis. A postdoc, and whenever you see this term, I want you to think, I like to translate it as after the fact, right? After the fact. So we conduct this type of statistic whenever we find that my ANOVA was significant, right? And what do I mean by my ANOVA was significant? Notice that if we look at our statistic at the top of your screen, notice that for ANOVA, we use an uppercase F. And here, similar to my t-test, notice that at the top, I'm looking for that variability between the groups that I could perhaps attribute to my manipulation. And in my denominator, I'm looking at that variability that might have occurred because of error. So after the fact, if we do come to the conclusion that my ANOVA was significant, that there was indeed enough evidence to say, yes, your manipulation was the one that caused those differences, and it is significant, now we can move to a post-hoc test. Now, what it's trying to do is after the fact, after post-hoc, after I have determined that there is a significance, notice that I want to see, okay, there was a significant, but which one, where exactly, what pair did actually have that significance? Because notice that in ANOVA, it's going to give me just a general result, right? It's only going to give me a general result of significance. But with a post-hoc, I'm trying to be more specific. I'm trying to find out, okay, which groups exactly, right? Which groups, in fact, whenever we pair them, which pairs did actually vary significantly. So post-hoc is just more specific about which ones were indeed significant. Now, generally, this is needed. This type of test in statistics is usually needed whenever we have more than two groups. And why is that? Well, because with many groups, right, we are able to do a wide variety of comparisons. We should do a wide variety of comparisons. Now, let's look into what a pairwise comparison is. Now, remember, a post-hoc refers after the fact. And when we are trying to evaluate what are all the possible pairings? What are all the possible comparisons that we can do? That is what we're trying to refer to as a pairwise comparison. Or we're trying to find the differences in the group and the means between all possible pairs, between all possible combinations. And something that I would like to remind you is that very similar to the error in our previous statistic, notice that the larger the error, the larger your denominator, notice that means if this one's larger, it is likely that the differences in my manipulation did not contribute to the variability, and vice versa. If this number of the variability attributed to error, if this number remains smaller, that increases the chances that it was indeed my manipulation that affected the results, that indeed looked into that variability. Any questions about that? Any questions? Good deal. Now, there are multiple ways, right? We talked about how does the data look like? How can we gather and put together that variability and determine whether or not if it was my study, my manipulation, my intervention, or if it was the error that contributed to that variability. But how is it that we gather this data? How exactly do we gather this data? So let's look into some of the ways that we can actually get this information. How exactly can I measure the dependent variable? One of the ways that we can do so is self-reporting, right? That the participant is going to let you know exactly their symptom reduction. So if we keep with our previous example, notice that in this specific case, we can say, okay, maybe the individual did an inventory of their scores in the assessment, say, for example, comparing treatment A and treatment B, which one reported frequency, for example, of feeling better and less likely to crave a substance use or crave drugs. So notice that is one way that we can gather data and measurements of that dependent variable. The second way we are able to do that measurement of the dependent variable is measuring the behavior, right? For example, you can say the speed of an athlete, right? The speed of an athlete. In a more mental health sense, think about a behavioral measure of, say, if you're administering something such as an intelligence assessment, speed is very important, right? So how long does it take the individual to solve a puzzle, right? Whenever they're doing an assessment. And now another way to measure, right? Another way to measure that dependent variable could be because of physiological features, right? Physiological measures. So in keeping with our hypothetical example, say, for example, you could draw blood and see how relevant or the presence of any chemicals and substances. For example, we do a drug test, and now we find out that the individual is indeed still consuming drugs. So these are some of the ways that we can do so. Let's break it down each individually. So let's revert back to our slides. Whenever we're doing a self-report measure, right, the participant is indeed responsible. The participant is indeed responsible to respond to questions, to statements, and there's multiple ways that that participant can do that. So for example, they can show their actual or perceived experiences, right? What they have perceived has been going on, or something that has actually occurred. And they're also responsible for letting us know their attitudes and opinions about a certain topic or a certain item. The benefit of a self-report measure is that it can be coded. It's actually relatively easy to code the responses of a particular measure, or we can turn them into a numeric scale. So for example, you can use a Likert scale, right? So you can use a Likert scale to transform that self-report measure from a verbal sense to a numeric sense in order for you to conduct your statistical test. Now, something interesting is that you can also conduct that measurement by using a single item. So you can only ask one question. Say, for example, hey, do you feel better of not using drugs? Or you can use many items, many behaviors that could be measured using a wide variety of surveys. Of course, it would be highly unlikely that you're going to get a good measure by just using one item, right? It's usually recommended that you use a wide variety. And if you remember from your lab, remember that we talked about assessments and your assessment written assignments for your lab. And we did talk about how a wide variety of items can be indeed reflective of a specific variable. So this is something that we actually observe live. Generally, one of the best advantages of this type of measurement is that it is cost effective. It is immensely easy to have an individual respond to a sort of assessment, a self-report measure, a survey, because usually the researcher, because it's so easy to administer and distribute, another aspect of that is that it makes the availability of having a lot of data in a very short amount of time very easy. I'm able to, for example, some of you guys responded to a survey, I should say, that I have for this class in terms of my delivery, things that you did like, things that you didn't like. Notice that I gather a wide variety of data in just a few minutes, right? So it is cost effective and it allows the researcher to look into data in a wide sense without having to spend a lot of time. The concern, however, is that generally self-report data is often inaccurate, right? We don't respond about ourselves. We don't talk to people about ourselves on how we truly are. When you are responding to a survey, you're just responding with the idea of what you think you are or what you want to be, right? Generally, very few people do indeed respond to items in a way that it does indeed reflect who they truly are. If we move to our second aspect of measure, notice that we can also measure the dependent variable through behavior, right? And in this case, that researcher is going to directly observe and record that behavior, say, of a participant or an animal, so a human or an animal. Notice that in order for me to measure a behavior, it's going to highly depend on how I have operationalized, on how I have defined that term. So in the beginning of the lecture, we talked about a hypothetical study in which I'm going to measure the flirting behaviors of people in a bar. But in order for me to measure flirting behaviors, I have to define flirting behaviors. So what is flirting? Asking somebody to dance, telling them they look good, buying them a drink. So in order for me to measure, it's going to be highly dependent upon that definition that I have operationalized, that I had created for my study. There are some advantages of this type of measurement, of doing measurement of my dependent variable with a behavioral measure, and that is, it is a very direct method, right? It's very direct. It's in some sense in a difference with that self-reported behavior, because now you may say, if I were to ask you guys in a survey, how many soda or pop drinks do you drink a week? And some of you may say, well, like 5, right? It's about right. But then when the researcher actually walks with you for a week and observes that direct behavior, maybe you were drinking 10 or 15, right? So notice that it is indeed a more direct measure of that behavior. The issue, however, is that it might have some issues of ethical concerns, right? Because some behaviors simply do not have a clear definition of what they are. So for example, think I want to do a study about abuse, right? So now I have to provide a clear term of abuse. Is abuse emotional? Is abuse psychological? Are we going to use the legal definition of abuse? Are we going to use the psychological definition of abuse, a community approach? So notice that now we are incurring an ethical concern, because what is the definition that I intend to use? And one of the last things that I like to cover about the measurement of a dependent variable in our between subjects design is physiological measures. This is where we are trying to record those physical responses of your brain and body, whether it be a human or an animal subject. Notice that what we're trying to do is measure either the normal processes or the disordered functioning of those physiological responses. So for instance, I'm trying to, say, for example, gather a blood sample, say, with my hypothetical of substance use research participants. Notice that this is indeed beneficial. And how can it be beneficial? Well, if you are doing careful collection, notice that these measures are unbiased, right? Either you use cocaine or you didn't use cocaine, right? It's not up for interpretation. It's a very concrete measure, right? So if we're doing the substance use, notice that, yes, indeed, did you use the substance or didn't use the substance? The problem is that it does require a lot of training, a lot of equipment that generally incurs in a specific expense. So as a summary of the information that we provided regarding our between subjects design, notice that there are advantages for this type of study. Notice that a between subjects design is the only design that meets all of the requirements of an experiment. Notice that this design does account for the requirement of randomization. It does incur in the aspect of manipulation, and it does include both a comparison and control group. This is the only design that will account for the 3 requirements of an experiment. Notice that in this case, much of the aspect of the research falls on the researcher and not necessarily the participant, which is indeed what we're looking for as ideal. Now, the disadvantage is it's likely that you're going to need a very large sample size, particularly when we're trying to observe more than 2 groups. So any questions about that? All right, beautiful people, and I'll see you in the lab.